Okay, so this section is about the reproductive system of newborns. You need to look at the images on page 642. You need to see what an uncircumcised and a circumcised newborn penis look like. You also need to look at racial differences in coloring, because if you're not prepared for that, that can be surprising. The maturity of the baby's genitals is an indicator of gestational age. So as part of the gestational age assessment, you're looking at that maturity. For female newborns, maternal hormones can actually cause a little bit of blood-tinged mucus discharge. That's not abnormal. We just note it and move on. The genitals will be slightly swollen with increased pigmentation, again, because of the hormones. For a male newborn, the uncircumcised foreskin covers the glands and it's tightly adhered. So we would never try to retract that foreskin in order to examine or clean. Okay, so it should be tightly adhered all the way down. Now, if that newborn is circumcised, they used to do really tight circumcisions, and so there was almost no foreskin left. And they kind of found out that skin growth is unpredictable. So some men ended up with a pretty significant, excessively tight skin. And so they tend to leave a little bit of the foreskin when they do the circumcision. In that case, part of that care is going to be retracting the remnant and putting some, usually some Vaseline or some petroleum jelly under it. The testes should be descended in a term infant. It's one of the things we look for. In preterm infants, they may not be descended, and so we're assessing for that. The scrotum will have rugae, will have little wrinkles and increased pigmentation, and the scrotum a lot of times is kind of swollen from those hormones as well. Breast tissue in both male and female infants may be slightly swollen from maternal hormones and may even have just a little bit of a milky type discharge. Again, that's temporary and is due to hormones. There are some potential problems with the reproductive system. One would be ambiguous genitalia. At times a baby is born and it's impossible to determine whether that child has external genitals that's male or female. Sometimes it's difficult to determine that. Sometimes the external genitalia doesn't match the internal reproductive organs. So ambiguous genitalia happens at times. Fistula is when the urinary, fecal, and reproductive tracts don't completely separate during development. So there are still openings that allow either feces or urine into the vagina, for example, or feces into the urine. Epispadias and hypospadias refer to where the end of the urethra, where the urethra ends on the penis. The urethra should end at the tip of the penis, but sometimes in development, that placement is not exactly correct. Epispadias is when it's on the top, somewhere along the shaft, and hypospadias is when it's underneath somewhere along the shaft. That's something we would notice mostly because if they're going to correct it, that baby cannot have a circumcision because they'll use the foreskin for the correction. We also assess for undescended testes, and we might note inguinal hernia when a loop of bowel comes down and there's an opening in the abdominal wall and a loop of bowel comes down into the inguinal canal. Okay, so the next recording will be about the skeletal system.